If you hypothesize, because again, I'll reiterate that the best I ever get clinically is based on our conversation, based on the assessment, it is likely you have a frozen shoulder. It is likely you have an unstable shoulder. It is likely you have rotator cuff related shoulder pain. And for most shoulder conditions, there are three main treatments to consider with adjuncts, of course. So there's injection therapy, there is surgery, and you mustn't ever say to the patient surgery. It is surgery, immobilization, followed by a lengthy period of rehabilitation, at least 3 months in most cases. So it's not just surgery, is not the word you use. You must, to fully inform the patient, it must be surgery, immobilization, and rehabilitation, and then rehabilitation by itself. And I would try and deliver that sort of information in the most unbiased way possible. If we talk initially about injections, and we're mindful here, we're talking about rotator cuff related shoulder pain, not frozen shoulder, where I think in the painful stage, injections are probably, although they're clearly with risk, there's no medicine without risk, it probably wouldn't be a medicine. For frozen shoulder, injection therapy, although it is with risk, is probably the one single condition in the acute painful stage where injection therapy would be of higher consideration. For rotator cuff related shoulder pain, publications we've done, whether they're narrative or whether they're systematic, would suggest that injections don't help much beyond 8 weeks, maybe 12 weeks in some people, and they certainly don't help everybody. Probably the best study that has been published, to my knowledge, was the Mohammadi study published in 2017, where they looked at the research and as a review, and they concluded that you only ever do one injection, that the effect of the injection, as we also reported, is probably not much greater than 8 weeks, that you have to inject 5 people before one person says, that's helped me. I don't mean you give the same patient 5 injections, you never do that, but 4 people won't benefit. They're not a quick fix and they need to be kept to the minimum. They increase the risk of needing surgery, and they also potentially may accelerate tendon and cartilage damage. So they are not something just roll up your sleeve and have an injection. Patients need to be aware of that. One of the handouts you have is this infographic that I give to patients. It's also will soon be available in French on the website, in Korean, in Arabic, in Spanish, in a number of different languages. And it sort of is part of your shared decision-making with patients. It sort of talks about the 4 major alternatives. We're talking about injections at the moment. And a lot of patients might not understand what 1 in 5 or 20% of people who have an injection, but I do find that if you present people with 100 faces and the majority of them are red and unhappy, you can see the likely benefit that you might have with an injection, and that might help people to make a decision that it is the right thing for them or it's not the right thing for them. And I'd be very happy to get feedback from you whether you find this infographic and the other supplementary material that you'll have access to after the talk is useful for you clinically.